Topic is post hernia surgery Pyocele. So, dear students, we'll discuss a post-operative complication and see what exactly it is. See, what is this post-operative complication? You can see the hernia surgery here and hydrocele surgery also along with that. But post-surgery hernia wound has healed, but there is something coming out. Slough is there, necrotic material is there, probably through drain site. And see that there is a swelling is there. So probably swollen scrotum, something coming out through this. So what is this condition is? It's probably pyocele, infected content here in the scrotum. So you have to do an ultrasound, you have to see a blood count, you have to do a CRP, how severe sepsis is, you have to start the antibiotic. The patient may be diabetic, this way test might have happened. And you may have to do MRI to find out the status of the mesh and other things. Then eventually it requires exploration to the scrotal area, may land with the orchiectomy. First, you have to send for culture sensitivity, proper antibiotic should be given based on the culture report, and low orchiectomy you may have to do. High orchiectomy for malignancy, for reticular tumor. For in this patient, low orchiectomy, where you ligate the cord to root of the scrotum using vicryl, like the polyglottic suture material, absorbable suture material. Whereas high orchiectomy, you have to use the non-absorbable suture material, polypropylene or silk will use. Where here it is absorbable, that is vicryl, and remove the testis. So many times, or at least drain the pus. And sometimes mesh also may get infected high up in the inguinal region. In such a situation, you have to remove the mesh also, because once it is infected, mesh will not stay there. So that has to be removed. So that is the complication which can occur sometimes after hernia and hydrocele surgery. May land with the orchiectomy. That's a point you have to remember. So it's infected wound postoperative period after right inguinal hydrocele surgery in a diabetes. See that it's a diabetes, very common in the diabetic patient and immunosuppressed individual. So this is what exactly patient was operated, hydrocele was there, and swelling, pain, fever, all those things after a week or so, after 10 days, because sutures have removed here. Probably after 2 weeks. Late complication. Late means not very late, maybe after 2 to 3 weeks afterwards. So patient was diabetic and cardiac patient. And so all these evaluations, ultrasound, CCT, MRI, and discharge you are sent for culture sensitivity. Vascular Doppler is important here. So that viability of the testis you can always assess by the Doppler, so that you can take a consent for orchiectomy from the patient. If testis is not viable, then you have to do the orchiectomy. Low orchiectomy you have to do. Mesh removal also you have to take a call for that. Re-exploration is very important. You can't just get away without doing anything, because here it has come out, slough has come out, in fact metal is coming out. You have to do a re-exploration to measure, get the patient become normal. So give a good wash, put it in again. Think of removal of mesh needed or not. If it's only lower part infection in the scrotal area, then not necessary. Otherwise, if it is extending up, then you have to remove the mesh also. Take the consent for mesh removal, take the consent for orchiectomy, then send the pus for culture, give a proper higher antibiotic also. Diabetes should be controlled, cardiac should be monitored. So a lot of things are there in such a patient. So sometimes it can happen. That's what I want to just say. Post-operative complication, even though surgeries, hydrocele and hernia surgeries are simple, it is not always simple. That's the point. Every simple surgery need not be simple always. That point you have to remember. So please go through my manual of surgery total chapter about how detailed method management of the hydrocele and complications of hydrocele, pyocele, all those things. And students, again request to subscribe my YouTube channel, and for daily day-to-day lectures, share channel with your friends. And lectures are mainly clinical case, post-operative problems, operative procedures, briefly, images and instruments. So brief lectures, it will upgrade your surgical knowledge, and day-to-day basis you learn. Daily you learn small thing about surgery, so that eventually you learn most of the parts. So surgery is over, daily, small thing to learn. It will be very, very useful. So please again request to subscribe my YouTube channel, share with your friends, and also join my live session once in a week or in 2 weeks. It will be very useful interactive sessions with not only with me, with the senior professors, where students will present the case, so case discussion, clinical assessment, analysis, differential diagnosis, management aspects. So around 1.5 hours, entire thing will be discussed. Very, very useful for a practical exam, and also learning surgery, how to go ahead with the surgical aspects, management aspect. also will be discussed. So join the live session. You'll get a certificate for that. If you join live, it will be useful for your future career also. Student, answer the MCQ. Most common types of hernia in females is A, B, C, D. Put the right answer. Acknowledge your answer. Answer the another MCQ. Landmark to differentiate clinically inguinal hernia from femoral hernia is pubic symphysis, pubic tubercle, actional ligament, Cooper's ligament. Put the right answer. I'll get back to you and I'll acknowledge your answer. Quotation of the day is passion is more relevant and genuine than the fashion. Remember, surgery is passion, not a fashion. Passion is only from the outside. So, passion is from inside. Surgery you have to learn from inside. You have to get involved with that. Then only it becomes fashion. Not outlook. From inside it should come. That is the quotation of the day. Students, again request you to join my YouTube channel and also share with your friends. Daily see the different lectures for 5 to 10 minutes. Upgrade your surgical knowledge. Join live sessions whenever notification is there. It will increase your practical point, clinical discussion also, students. And please go through the MCQs, put it in the comment box. I'll acknowledge your answer. So students, I hope you have understood this lecture very well. Thank you so much.